saying, did you do the test? They'll say, yes, here's a certificate. Everybody's happy, covered their backsides, and it stays that way. And hopes that nobody gets killed.
Right now we have someone who said, "Can you please put out the list of cough syrups so that we can avoid it?" Now, here's the thing: the names don't matter, do they? The name is
Exactly.
just a label on the bottle. It's what's in the bottle. Could all be manufactured by the same guy. Whatever you are buying could also be manufactured by the same guy under a
Yes.
different name. Is that correct? Mhm.
Yes. So the reason we can't tell you what is safe is two. One, we don't know where it's manufactured. Secondly, we don't know what the ingredients are, who the supplier of those raw materials is. So we're going further and further away. Even if you do identify the brand, if you do identify the plant, how do you identify who the supplier of the raw materials is and what the check is on that person and the product, the raw materials that are coming into this? How do we know they're checking it at the entry of the raw materials into the factory? Are they just looking at a certificate which says we've done the tests and it's all okay? Are they actually checking it themselves? So the US FDA, for example, requires the whole supply chain to be tested. So even if you have a supplier who's giving you a product with a certificate saying, I've done all these tests, it is necessary that the manufacturer, before it takes this into its factory, so there's a separate place for raw materials, they're kept there, they're checked again. So the raw materials checked before it comes into the factory. There's a separate holding area for raw materials, separate one for active ingredients, separate one for excipients. So these are all designated areas separate from the manufacturing part of the factory. At that place, they will be held as if it's a quarantine until quality control says, yes, we've tested it, and yes, it's good for use. So that's the extent to which the Western world, the developed world, will make sure that nothing goes wrong.
Here's the irony: India is the largest manufacturer of pharmaceutical drugs for that Western world, developed world. We also know that the US FDA regularly sends teams to India to
Yes.
audit the factories in which these drugs are made, which they then allow to be exported to their country. And a lot of times they put freezes, they stop it, they suspend
Yes.
licenses till such time as
Yes.
things are not up to scratch. In India, we know how to do it right because we do it
Yeah.
for the US and for Europe. We don't do it for our own country because we don't have regulators enforcing these laws for our own country. So, as a country, pharmaceutical companies are making products that are safe for children in the US. They know how
Yes.
to. They're not
Yes.
bothering to make it that way for India. Nobody in India is checking. And worse still, there's something worse than that. We're exporting rubbish to what is called the
Yes.
global south. Now,
Yes.
here's this we have to address, Murti. Enough has been written about the fact that the African continent is used as a dumping ground by pharmaceutical companies across the world who do it with impunity. They don't care about the damage that they're doing. Is India now guilty of doing the same thing?
Yes, of course. If you look at a lot of the smaller companies which are exporting, that's the bread and butter. So if you look at this very company, most of its income seems to be coming from exports. So it's not the big guys that are exporting to Gambia and all those countries. They may be doing a little bit, but it's a really small part of their world of what they make profits from and where they sell to. The smaller guys, thousands of them, are all over the rest of the world. They are cashing in on the reputation of Indian pharma, but actually ruining it by what they're doing there. And with a lot of these markets, Faye, they're very porous borders. So just because you've sent product into Gambia doesn't mean it remains in Gambia. Especially with cough syrup, drugs that are sold over the counter, they this then get pushed around to all the neighboring countries. So I hope it doesn't happen, but we could see this product popping up with neighboring countries around Gambia saying, "Hey, we found, a crate of this stuff next door." There aren't really checks to move this across. This one may be a little less, but we have lots of others, especially those that contain codeine, which are used by addicts as substance abuse. That has a black market that is all over Africa. So you import into